Hey, this is Dr. Ben Pearl with FitFootU. Today we're going to be talking about iliotibial band syndrome, very common with runners. And the one thing about doing orthotics is sometimes because they are already riding the outside rail, and we're going to take a look at that in a minute, you need to get the support underfoot, but you also need to go in the reverse direction in a little valgus in the forefoot and the rear foot, and I'll show you how we do that. So let's first take a look at this situation. This young man has been running in a Brooks Ghost. We also talked about a wider footprint with maybe a ultra shoe with a little wider footprint so that he can't tip as much, or going up to something like a Brooks Super Ghost shoe. They have the new Brooks Max shoe that would give him a little more stability. So let's take a look. So we've got a typical situation here where you can see there's a little bit of tibial varum, the knees are a little bit close together. He is riding the outside rail a little bit. He's especially on that left side, if you see left to right, he's just a little bit more swiveled to the outside, tipped to the left on that left foot. So the intervention is going to be an orthotic. We also did some PEMF, and we're going to show you how we can customize a heat molded one. In this instance here, we're doing a grind just a little bit on the medial or inside border, so that when we look at the heat molded orthotic from back, we've got it tipped in just a little bit to the inside area, as we've taken off just a little bit more on the inside edge. The other thing that we'll do here is we can add just a little bit of a tip post. And so we're doing that. We're going to adhere this. We've already pre-treated with a little bit of glue. And this is called a valgus post. So what we're doing here is, once we're done, we're now going to have, from the backside view, just a little bit more of a cant so that he is not coming back to the outside as much. Now, implementation. What were your sort of thoughts, so far in terms of what the experience has been with these heat molded orthotics?
Yeah, they seem to keep my foot a little more like cradled in there, especially once we started.
It's got a nice deep heel cup, yeah.
Yeah. Yeah, no, they definitely felt like they've.
Yeah, initially we just did it to the left on that valgus post, and now we've added one to the right because you liked it on the left, that little 4-foot black extension piece, kind of a tip post, if you will. And we'll see how you like it. Let's see what. The other thing, of course, we've emphasized ITB stretching, ITB strength exercises, balance drills. Rolling out is very important with ITB as well. Okay, how do they feel now?
Yeah, I feel great.
Yeah, you're a little more, you're not quite riding that outside rail as much either. Looking a little more stable there. All right, so we've got a good result here. So in summary, just with a few simple changes to the foot bed or orthotic, we can make some impactful changes, especially for a repetition thing like ITB with distance running, and he also plays some tennis. So till next time, we'll see how he's doing, but already feeling improved. This is Dr. Ben Pearl with FitFootU.